in the same way that, like, I feel like mental health has had such, like, a really good exposed maybe movement, if you wanna call it that, over the last, like, decade where people are just, like, being so much more open about, like, "I take
Yeah,
SSRIs," or "I take these," which is very helpful and very needed because
yeah.
it's the idea of normal where we're all, like, very much so starting to understand neurodivergency and is that a right word?
Yes, it is.
Neurodivergency? Anyway,
Neurodivergency, yes.
we're
Yeah,
starting to understand that in a mass way.
yeah,
So, like, is someone a drug pusher if they're like, "Hey, if you're depressed and need medication, that's okay?"
yeah,
No, they're
no.
a health advocate
But
and
in
they
all
have their
fairness,
eye there
I
too.
do also, like, have a whole show about it, like, but sometimes
Okay.
it's weird, but I'm trying to focus more on, like,
You
what's it been like for you guys seeing me do this? Like, were you thinking that I was a drug pusher?
no,
When you were like, "She has
no,
a podcast about it, she's on
No,
live and
no,
making videos," like,
no,
what were you thinking when you were
no,
seeing all
because we
this?
saw
no.
the results.
Yeah.
We
Yeah,
saw what you did, Kimmy. That was amazing. And we were
But
like, "Oh my gosh, what are you doing? You're doing amazing stuff here."
but even
And
before that, we
yeah,
saw the journey prior, right? We saw the, like,
sure,
you didn't get pregnant,
absolutely.
you did this surgery, you were able to get
Yes.
pregnant, like, we watched that whole
We
journey
watched your
firsthand.
life.
yeah,
And
Yeah.
the misconception in the same way that people look at a
Mhm.
neurotypical brain person would look at a neurodivergent brain person and say, like, "I don't understand why you can't just, like, set an alarm and remind yourself to do that," because it's a different brain. So
Yeah.
someone would look and say, "I just don't understand why you can't just, like, move your body and eat less," like, because
Right.
it's a different body, you know?
Right.
And there's just so much shame
Yeah.
attached to people with larger bodies that it always equals laziness, lack of education, da da da, da, whatever, and
Yeah.
it's just not true.
no,
Those things are not, like,
yeah.
equal
Not
things.
Someone
everybody's
asked
the
me on this
same.
podcast lately,
Yeah.
she said recently, she said, "Is there a world," she said, "where people can get off of this medicine and that they've learned the things they need to learn,
I
right?
know.
And then they're okay." And I
Mhm,
said, "Well, 1, I'm not a doctor, I just interview them on the internet, you know?" And I said, "But what I think we can all agree to is that I think the food noise is a spectrum, right?
yeah,
And I think that ultimately some people may have it like if you think about it like when you're pregnant, like I know you don't know yet, but like when you're pregnant, those cravings that you have, they're so intense, right? It's way different than just like a craving you have when you're on your period. Like you feel the level of intensity when your body is different and is shifted. And I feel like what I was trying to explain to her is the level of craving when you're pregnant. I had that all the time. And then mental instability because I was always worried about that all the time. So when I started to solve for that, and I do think a lot of that anxiety has to do with blood sugar and getting that controlled, but I was trying to sort of explain it to her that ultimately there may people that it's like that's the new trend guys right now is the whole micro dosing trend, which is
yeah,
people that are in thinner bodies or may just struggle with 10 pounds or 5 pounds or whatever, and that they just get a lot of benefit from these meds from taking them for all of these different health reasons that we're suggesting. And maybe they have food noise, but they were able to white knuckle better than you and I were. Or maybe their weight gain was like 5 or 10 pounds, but like ours is 80, right? Like it just sort of like it just seems like this like spectrum, but clearly we've identified that so millions and millions of people, whether they are in obese bodies or just bodies that are struggling with overweight, right, have seen massive health benefits from this, but there
mhm,
has to be a reason why. And
mhm.
I do think that there is some nasty, dirty shit in our food. Like I'm sorry, mom, don't tell daddy I cussed. But there is like there has to be like I think because there's got to be a reason. I always say when I say a bad word on accident because I get passionate, I go, "Sorry, dad." And now people have drinking games with it.
You say,
Whenever I
"Sorry,
say,
dad."
"Sorry, dad." Yeah, it's funny. But yeah,
No,
but I
I
think
think
that
it's like the most open secret in the world is that
yeah,
our food sucks. You know what I mean? Like,
yeah,
really, like,
yeah.
but it's just
But what's difficult is, like, so recently
yeah,
I got because I do this, I get to meet with thought leaders and people in the space about, like, how do we adjust to this, right?
yeah,
And, I got to meet with, people from Campbell's, Tyson, Coke, Pepsi, and all these different, like, food companies, right, recently, and basically he was kinda like one of them, Campbell's guy was like, "What if we, like, put a bunch of protein in your soup? Would you eat it?" And I was like, "Well, if you didn't have a lot of gluten in it, I probably would." Like, that's kinda my thing. I go, "But ultimately, you have to understand what you guys are doing is just stuffing protein into food, but a lot of us understand that that food probably led us here. Like, it played a role, right? Like, in the types of food and our metabolic disorder. So it's hard to trust you."
Yeah.
right? So if we don't
Also, I
trust
don't
our
want it.
doctors and
Yeah.
we don't trust, our food, who the hell can we trust? And the answer is each other. And that's why these communities are existing, right?
Yeah.
And like I got to go to obesity week this week, and there was these doctors up there talking about kind of trying to change and better the system. And I went up there and I said, "Are you considering trying to work on patient trust?" I said, because ultimately, even though you guys are prescribing this, me on the internet, I'm the one getting the questions. I was like, and even though they know you are the prescriber, even though they know more than I do about this, they're not asking you, they're asking me.
Because
So
they know that they have a purse string attached to what they're asking,
yeah,
even if they also have a good nature. You know what I
right.
mean?
Yeah.
Yeah.
And
Mhm.
I think too, people also very much want to be able to feel like people empathize with them. And ultimately, the system and the trust between our clinicians who have honestly blamed most of us with obesity forever, that
Yeah.
we were obviously lying. We were not dieting exercise, or we couldn't do it, or we were weak, or we were fat and lazy, or whatever. Right. Plus the food just continuing to give us more crap. And like literally, there are food scientists that try to make more foods hyper palatable. And we know it. Like
Mhm.
that all of this knowledge is out there now, and we see these two things together when clearly they're clashing and causing this metabolic decline, and
Yeah.
at different levels and at different increments than other people, like mom in a 150 body, right? Me in a 250 body, like other people in a 660 body. Like it's clearly, I mean, even people that are like 120 pounds that want to be 110 or whatever, like depending on how tall they are and stuff,
Mhm.
clearly like there is something going on, and that food is not doing well by us, and it is affecting the food companies and the food bottom line. But
Yeah.
what's crazy about it though is that we've just opened up a lot of access, right, with this news, right? For with Medicare covering this and then opening up those prices for Medicaid to then cover it, this opens up access to millions and millions of people that could not afford these medicines before, and now they can. So
Yeah.
my concern is they don't trust their doctor, they don't trust food. There's
Mhm.
nothing really in the middle in terms of community other than like me and other people who do these kinds of shows, right? And have these kinds of platforms.
Mhm.
What are people going to do?
Right.
Right. And
Right.
so my concern is they're going to know what to eat or how to move or what, all these different pieces that I feel like we've kind of figured out together. And I don't think the doctors have it all figured out either. Like the obesity specialist, yes, right? The endocrinologist, yes. But there aren't even enough doctors literally in our country, period, to be able to treat the amount of people that have obesity.
Yeah.
Like there's not, and so it's great that we have this access open, but I'm very concerned about this gap and this gap in trust between food and between doctor. And I don't know how to solve for it other than to continue this podcast.
Right.
Know what I mean?
Mhm.
I mean,
I,
I think
and my
that
social and everybody and like my community, not just me, to be clear. I do not think that I am solving any of like I am an advocate with many other people who are just as passionate and work just as hard as I do. Like it's not, I'm not trying, but I am a
Mhm.
leader in this movement, right?
yeah.
And because I care deeply about you, every one of you that are listening, I care deeply for you and want you to be able to live the healthiest, life that you can. I think that you deserve that and are worthy of that. And I think everyone that you love, right, that struggles like we do are worthy of it as well. And
Yeah.
then I do think that there's a certain piece of us that we do need to demand what equals quality care, right?
Yeah.
It needs to not just be, let me write this medicine and you're off on your way. Like we deserve
Mhm.
a certain amount of community support and, checking in with us. And if you guys don't have if these clinicians don't have the staff or the capability to be able to do that, then we've got to have something in the middle that does, right? I don't know what that is and how I can help solve for that, but I do want to.
Well,
Yeah.
I think you're doing it. I mean, our country is in a massive state of like a scary level of normalization of for the sake of survival, trudging forward every day, just being okay with some of the horrific things
Yes.
that are happening around us.
Yeah.
And this is no different because this is not, like I said, this doesn't exist in a vacuum. This topic of health and obesity in America is wrapped up in every awful systematic thing that is happening as well.
Yeah.
Because this stigma of larger bodies is also the Venn diagram is a circle of the stigma in poor communities as well. And like
Mhm.
people trying to demonize those communities for like stealing benefits from SNAP,
Sure.
whatever. You know
Yeah.
what I mean? Like,
Yeah.
no, they're people that need food. And
Yeah.
you know what I'm saying? Like it all exists together. And so the very first step in someone having a change in understanding or perspective comes from someone delivering a message they've never heard before. And that's exactly what you're doing. And so I know it can
Mhm.
feel maybe monotonous or feel like, am I a drug pusher or am I like
Yeah.
doubting this, like,
No.
am I just the Quiznos guy with the sign on the street, like,
Yeah.
just waving the sign around as people drive by and hoping somebody goes in to buy a sandwich?